We will start with a volunteer. You can raise your hand. Which group would like to go first? Were they numbered, Michelle? Maybe we could just go in numerical order.
Yeah, all the rooms have numbers. Room one is Amanda, Dayanara, Deidre, Taylor, and Zena.
Okay, then we'll have group one go first.
I think that was us. Yeah, so for benefits, our group came up with that it's a tool to educate the staff to know what to look for as far as delays go and how to better assist them with appropriate activities. Also, it's a tool to educate them about the developmental areas. And it's a tool to help parents discover if their children have a delay in one of those areas. Did you want me to do the challenges that we came up with as well? Okay. The challenges we came up with were the price point of about $300 might be a barrier for some FRCs. Staff turnover would having to train the staff each time. And families not understanding the usefulness of the tool and refusing it.
Very good. Thank you. Group two.
I don't think I know which group number we were.
Yeah, sorry, but a lot of people don't. Group two with Anthony, Kristen, Maria, and Rose.
Oh, okay. Okay. I had a feeling. Okay. So for our, I guess for our three benefits, we mentioned that they can receive service. They can get help earlier. So the faster they do an ASQ, or the sooner, then the sooner they can get services for the kiddo at an FRC. Also the convenience of being just kind of like a one-stop shop. So when they do ASQ at the FRC, then we can connect them to other resources as well. And then just creating those connections with caregivers. If you haven't created one already with a particular family, then that would be a good time to do so. And then providing activities for the children. And then for our challenges, we just mentioned denial. So like parents kind of overlook the needs of the children when doing the ASQ. And then bandwidth, so staff availability when doing an ASQ, right? There's only 2 of you guys, and then there's multiple families who need to do one. Also, last one, and it's not a home setting, so sometimes ASQs may look a little different if they're at a FRC rather than at home, because then the kiddo might be shy, anxious of the provider, things like that.
Thank you. Number 3, Michelle, would you just read out who's on?
Yep, it's in the chat. Kennedy, Katya, Leticia, and Keta.
Well, I talk a lot, so I don't know if anybody took notes, because I was talking and talking. So I don't know if Leticia wants to share something, or Kennedy or Katya.
We didn't really talk about the benefits. We kind of were struggling because we were saying that, in our FRC, we don't do ASQs. But Keto was mentioning that in the sunrise therapy, they do ASQs, but the parents don't follow through afterwards. And so we were talking mostly about that and how it was a challenge.
Yeah, we partner with Sunrise Therapy, and they come and do a class. And when do the class, they decide to do the ASQs, and parents are very open to do it. But then once we find some kind of developmental concern, and we refer them to our department at the district, which is called Search to Serve, they say they are going to follow through, but they really don't follow through. And sometimes I worry about losing those parents because they feel intimidated that they haven't followed through. And then they feel intimidated to come back. But because it's a different agency, they don't feel like that. But if we do it, maybe they would feel like now we are doing it. Now I don't come back anymore to the center. So, I mean, and it doesn't happen all the time, but there is always those kind of parents that feel like that.
Good points. Thank you. Next group.
We have Anarelli, Don, Jill, Mario, and Yenny.
Hi, I can talk for our group. So we also kind of focused more on what we see as challenges, only because we are unsure of where this is going. So we had questions. Is this something that maybe First Things First is going to be interested in funding and, asking the resource centers to follow through with? The reason we would like to know that, and I know this is just a discussion, so you probably don't have answers, Patty, but the reason we talked about that is because some of us have had done ASQs in the past. We were trained through ASQ from Brooks. Actually, my trainer was Elaine Chan. I don't know if she's still there, but we got trained and we used to work with parents. Again, that follow through we didn't see from the parents, but we were able to give them support and resources, especially with ASIP or Child Find. So we would refer out to Child Find and ASIP. But when we used to do that, it was funded by First Things First, and then that funding went away. And then I was told I couldn't report ASQ numbers if I did continue because it wasn't part of the funding. And so based on that, I decided to not do ASQs anymore. But we do also partner with Sunrise Therapy, and they do the ASQs before classes, and then they follow up with the parents, and then again, the parents. Some parents do follow up, others don't. But I loved ASQs, but again, since I didn't have the funding, I couldn't continue. And at this point, I feel I don't have staff, and most of us in the group also discussed not having the staff to follow through with the ASQs and everything that goes with that. And then I also believe that we probably will need to be retrained because I'm pretty sure things have changed. But yeah, my training happened years ago, so that was our group.
Thank you, Yenny. Kat, did you want to talk now or do you want to wait till everybody's shared?
I mean, so historically, First Things First is always growing and learning, just as we all are, as ground implementation challenges
it's on the screen right now.
Yeah.
occur, and as the ever evolving landscape changes. And so one of the things that we know right now is that screenings aren't typically happening at places where we have made assumptions that they have happened in the past, or where they are more likely to have happened at the past, like through a pediatrician's office, for example, and that community-based locations are a really wonderful place for screenings to occur because this is where the families are. In terms of funding, I really don't know what state fiscal year 2028 is going to look like, but we're looking at what is the future of family resource centers and what can they do. And we know that nationally, a lot of our partners in various states do ASQs within their FRCs. And it's not really like, a massive ongoing funding amount. It's just training and materials and supplies. But then once that is there, it's there, unless there's lots of staff turnover, which is a separate problem. But essentially, we're really interested in it because we know that we have home visitation, which is not for all families. Some families are going to want to enroll in home visitation. It's, very intensive. And some families want less intensity, but they still want that ongoing family support. And so they're going to family resource centers. And we know through your duplicated numbers, they're there quite frequently. And so when thinking about our community-based family support, family resource centers really are a great place for screening to happen. And as you guys have various ones of you have mentioned that you're still doing ASQs through different partnerships anyway, right? Because it's a really smart thing to do. And so we know that through different collaborations, there's various screenings that are happening within the context of an FRC, even vision and hearing screenings. So we're really looking at the landscape, child find, AZIP, funding, what it means for family support, all of that, and really in this information collection phase to see what we can do for 2028. But it's a good idea. It's a very good idea. It makes a lot of sense.
Thank you, Kat. Thank you, Patty.
You're
Yeah.
welcome. Thank you for your input. It's invaluable. Okay, next group, Shelley.
We've got Jackie, Leonora, Lourdes, Stephanie, and Tracy.
Okay, so I made this beautiful whiteboard, but it's not letting me share it because apparently you can't share that when you're on a shared screen. So we're just gonna go off of memory. It should be on existing whiteboard, but that's okay. We did a pros and cons list. And ladies, if you'd like to step in, that's totally fine. From what I remember, we said that it's easy for families to approach an FRC and talk to us a little bit about their challenges and what they feel like the areas that the child is struggling in, and how they want to find, I guess, support for them. And that's something that I guess they don't mention. They're not likely to mention at a pediatrician. Things like social emotional, those kinds of things. And we did mention that it's a little easier for parents to approach at an FRC as opposed to a pediatric center. I mentioned that our center has the ability for families to walk in and not have to give a lot of documentation or information. We do have Southwest Behavioral Health here that does, they do other types of assessments. They do support with autism assessments and those types of assessments, but they do require information because they use healthcare insurance. And so a lot of families are right now reluctant to give that information out. So that's one of the benefits of approaching our program, because AFERP is what we call our program, Avondale Family Education and Resource Program, and families will come and approach Anthony and I, and they'll ask, like, can you do a hearing and vision screening, or can you help me with my child, because I feel like it's either like a communication, a social emotional, or something's going on where the child's not meeting the parents. And I don't want to say expectation, but mostly it's parents that have a couple of children, and they're kind of like seeing that something's different, or something's not to where it's supposed to be, and parents do compare, well, my older child was doing this at that time, kind of a thing. And then we do provide FTF's milestones workbook, and we do go through that. So it just opens up that opportunity. They don't have documents. They don't have to provide them if they don't need to. So there's that benefit as well. What else did we mention? Pros, ladies.
I think that we mentioned that our families are not required to fill out a lot of paperwork or have insurance, so they might feel more comfortable coming to do this type of questionnaire at our center.
Mm-hmm. And then cons, was it Lourdes mentioned that, what did she mention? Now I'm like forgetting.
She's part of a school district, and so the requirements for for being careful not to give a diagnosis or misinformation is very strict.
I believe that was Stephanie that mentioned that
Stephanie, yes.
she's part of the school district. So there's she doesn't do ASQs, and there's very little she can do because, you know, she has to follow those guidelines. So if you are at a school, which Ms. Guetta was in the last group, I know I was at a school with her, you're limited on what you can do. So you do have to refer parents out. There are guidelines that you have to follow. There's state guidelines, and then the district has their own set of guidelines. So Child Find is where you refer those children or those families to, or AZIT. And it's something that you can't like diagnose or support a parent with. You can give them information though, but ASQ would not be something that you do if you're within a school, in a public school setting. There was something else that Lourdes had mentioned, and it slips my mind. Lourdes, would you like to speak?
I think it's me, Leonor.
Or was it you, Leonor?
Yeah.
One of you. Okay.
So what I said is that so we used to use or do ASQs before in our agency, and the family support coordination, we use them to help the families identify in what stage the kids were, and then we will set up a goal and work, you know, with the families and helping the kids to get the
Right.
skills to increase, you know, and be ready for kindergarten. And then also, if we needed to refer them to ASAP, then we will help them, refer them and help them to make sure that they follow through, and then, you know, checking on them and asking them if they need more support and things like that. So I think that it is a great tool to use, and especially on with the family coaches or family support coordinators.
That was one thing that you mentioned that I was thinking. That's true because a lot of families say, well, what can I do at home? Or like, what can I work on? And it kind of helps you kind of guide them on different activities they can do, or like areas where they need to support their child a little bit more one-on-one. So um, that's true. Yeah. And then another thing that I was mentioning right before we ended the group discussions were that I used to work for Southwest Human Development, and I used to do like assessments because I was part of the inclusion program. And I remember we had 90 days to finish all of these assessments, right? Because we were beginning either to write an IEP, or we were either thinking that the child had challenges, but we weren't sure because the child was a little shy, you know. And I felt like it gave us an opportunity to get to know the child. The difference is here when a parent schedules a child for an ASQ, they might come in like very, very standoffish and very shy. And so we start going through the ASQ and we try to make it playful like, and sometimes it doesn't, sometimes they withdraw a little, so it doesn't always turn out all that great. So they could fail on some things and we'll have to ask them to come back. You know, it just depends on the child's temperament and how it goes. But that was one of the benefits of doing it in the classroom, was because you actually knew the child. They got to know you. They had I guess that relationship with you that had already been established. So, and then that's all. That's all we have.
Thank you for all of that. Do we have another group?
Yeah,
Michelle?
one last group. We have Casey, Haiti, Rihanna, and Victoria.
Hi guys. So I mean, we're the last group, so you kind of already said all the stuff that we had talked about. But just saying that doing the ASQs is super beneficial for the families because it helps them to be able to advocate for themselves and to have that evidence-based paper that they can take to their doctor and say, hey, I noticed these because I worked in early Head Start and we saw the physicals that we would get from the doctors, and I'd go, oh, did the doctor talk with this and this and this? And they're like, no. So even though the doctors have a checklist of things that they should be doing, they're not always going down that checklist. So this gives the families that evidence-based paperwork and that documentation to take into the doctor and be like, look, this is where we're at. This is what we're seeing. You know, we can talk to them about self-referring, but I mean, we always refer back to the pediatrician and say, if you have a concern, talk with your pediatrician, because I can't diagnose you. I can't say that something's wrong, but I can say, here's where you're at and here's where you should be, or here's where you're working on getting towards. And then for the challenges, definitely the privacy. So if there is a parent who has a lot of concerns, you know, I'm in a room full of kids and a room full of parents, so I don't have anywhere private that I can go and be like, all right, let's come over here and talk about it. But I've seen it done. I have a program that's come in to do ASQs with families before. And what they do is they teach the parents how to go through the questionnaire and give the questionnaires to the parents, and then their staff goes through and not grades, but does the checklist on the back. And then talks to the parents one-on-one about how their ASQs are looking. So that puts the power back into the parents to facilitate it themselves and to be able to see those things. It also makes it a little easier on the kiddos so that they can be more comfortable with their parent instead of some random person coming in saying, all right, Johnny, can you jump? Can you stand on one foot? Can you say your ABCs? It's mom or dad doing it, which makes them much more at ease. So, but I think that's it.
Thank you. This is a really rich discussion. I really appreciate y'all taking all the time to do that. There are a lot of things to consider, you know, as y'all pointed out, but I will say that don't be deterred. There are a lot of ways to, like I said before, it's flexible. So there are a lot of different ways that you can go about this, and I'm going to get back to my PowerPoint here. Hold on. Huh. It's not coming back up. Are you all seeing it?
I see it. Yeah, it's the benefits and
Okay.
challenges.
I think I just have you all too big. Okay. That's what it is. Hold on. Let me go back to the. I need to get. Okay. Well, I'm not seeing my PowerPoint, so I'm good. Let me stop sharing for a second. There we go. All right. Let me share again. There we go. Okay, now I can see. All right, so one of the things I wanted to know is, are you interested in becoming trained in the ASQ? So we've got a poll. If you could go ahead and fill that out, I'd appreciate it. And you can do multiple answers. Sorry, my dog is barking. We could get the rest of you to answer, that'd be great. Well, it looks like there's a lot of interest. Okay, definitely if there's no cost, and definitely if there's moderate cost and potentially within the next year. So I'd say yes, that's great. One of the things I wanted to do was to make sure that you, first of all, if you have any questions for me, but secondly, be encouraging about it. I think that there are always, with anything we do in the family resource centers, there are pluses and minuses to different things. I would love to be doing it again, and I will do it again. My staffing just right now isn't right for it. And so it is one of the most, I will tell you, it is one of the most powerful indicators of how we can be helpful to families. 1 year when I have this data burned in my brain. So one year we did 98 ASQs, one-time ASQs, and 19 of them came back with either in the monitoring zone or in the refer zone. And out of that, 7 were definite referrals to ASEP. And out of those 7, 5 definitely qualified for ASEP. Now, you saw before when I talked about the sorry, my dog's distracting me. When I talked about the long-term benefits and impacts for children, it affects their whole lives if they can get early intervention. So there is a way to do it. Don't be deterred. It's a really fun thing to learn, and it's really rewarding in terms of the relationships that we build through it. But if you're going to do it well, or don't do it, because as some of you indicated, there in your cons, as some of you indicated, you've got people, you're dealing with very sensitive subjects. You're dealing with people who have concerns, who have worries. And the last thing we want to do is to make it worse for them. And so we want to be a value added, not a detractor. So, and I'm certain with Kat and the rest of the team in the family support area, I'm certain that whatever next steps we take, that they'll be done well, and that it'll be very thoughtful and with technical support to be able to help people be able to do it. And I'll tell you one thing, the training itself is something that you will be amazed at how well you're trained to do it. So with that said, I want to ask if there are any questions, if you'd use your virtual hand to ask any questions. Any?
Yes, Patty, I do have a question.
I put my dog on mute.
So one of the discussions that I forgot to mention, we talked about how I love your slides. Your slides are awesome. The reason I say that is because I think that, like for me and my resource center, I'm the only one training ASQ. Everyone else is new, and but if I was to tell my staff we're going to do this ASQ training, they would say, wonderful, we can help new families, new kiddos. But I love the way your slides are because it shows the why, the benefits, how it ties in. So if we were to move forward with ASQs, would you share your slides? I think we're all, we have our own unique way of learning, and your slides make all of us see it in a different way, and then understand the process and how it ties in with the families we serve and the kiddos that we are helping daily, and just working with those wonderful families.
Thank you, Yenny. Any other questions? I did see in the chat, Christine, from First Things First. And she said she just wanted to share something quickly as well. There will be a new resource available soon, called Is My Child on Track? Navigating Developmental Screening and Resources in AZ. This tool will help families and providers understand developmental monitoring, milestone screening, and the early intervention system in our state. Christine, do you want to talk about that a little bit?
Yeah, so just need to make sure my right ear plug is in for my mic. Yeah, so this very well done, Patty. I think this is a great, conversation, and hear all of the feedback and the desire, and see the value of incorporating this in all of the work we do moving forward, because families benefit so much from it. So this is also, as you know, home visiting is a crucial mechanism for delivering developmental screening to families. That is only a subset of families who are served by home visiting programs. But as you see, this comes up as a challenge even for home visiting, who do these ongoing screenings and have received the training. So all of the things that were talked about today are present across family support sectors. So a subgroup of the statewide leadership team has come together to create, as a first response, some sort of resource for, initially it was for home visitors, but we started hearing from family resource centers and pediatricians and AZIP. Like, this kind of bringing us all together for what this system looks like in our state is super helpful. So the resource is intended for families. So the audience is families, but the idea is that is a tool that providers will introduce and talk through with families. So it's really dual purpose to help support providers in their knowledge, and then in talking with families about what this looks like. So tip of the iceberg, but these conversations are happening across sectors. So this is very timely and wonderful that we're talking about it now. I don't know when it's going to be available. We don't know like the mechanism of that yet or how it will look, but I'll be sure to share as soon as we know more.
Great. One other thing I wanted to mention too, I was at the Roosevelt. Not everybody who is at a school is limited by the fact that they're an employee of the school, because we're at a school, we're at Roosevelt, but we're not employees of the school. We're employees of the U of A. So I know that there are some other school-based centers where you're not in the same situation, where you're part of the school district system and the school special ed system and all of that. And so, so in our case, we have a lot more flexibility, but we still collaborate with the school district. And I went to the school board the other night, and they were doing a wonderful data report on how they were doing to achieve their increases in their scores on their Arizona testing for reading and math. And I was just like in awe of all the data that they had, and all the professional development they're doing with the school, with the teachers, and all the gains and strides they were making. And so I was actually doing a call to the public. And so one of the things I was able to do was to tell them how we're helping through working with the families on emergent literacy to help them, prepare to be able to read by third grade and all of that kind of thing. And if I had the ASQ data, to be able to back up all of the things that we were able to do, all the children we were able to help catch up, all the children we were able to get early intervention, that would have been even more awesome. And so I'm even more excited to get to the point where we will implement them again. I'm hoping for the next fiscal year to be able to do that. Yenny, do you still have a question? Your hand is up. Or a comment? Oh, okay. Thank you. Okay, well, it is 3 o'clock now, friends. That time went fast.
I do have one request. If you all will click the link in the chat, the PD survey link, and please give us feedback on this PD session, I would really appreciate it. All right.
you, everybody. Have a good rest of your day.
Thank you all.